Thank you for tuning in to this presentation entitled A Conversation Engaging Stakeholders. I'm Pam Salisbury, and I'm a professor in the College of Public Health at Ohio State and the director of the Community Engagement Corps within the Ohio State University Clinical and Translational Science. First, I want to emphasize that if you're a researcher, then chances are you need to be thinking about how to engage and or include your stakeholders in the research process, no matter where or with whom you work. This is not just about doing community work as traditionally described, but it is really for any researcher who wants to be sure their efforts are targeted and impactful. So again, anybody that's in the research field that wants their research to be impactful, I believe this introduction can be helpful to you. This is the community engagement team within the CCTS. It's myself, Jeff Griever, that you're going to hear from in a few minutes. And he is the community engagement program manager, and Beverly Stringer, who's also a community engagement program manager located in Southeast Ohio. So what's the problem? We, as researchers, think that we can go about our research, publish our papers, and change the world, right? Well, it turns out that doesn't work. And we have known about this problem for actually several years. That is, that there is a very long time from when research is done to impact, if there ever is impact. Several years go by. We make investments very early in the science, in our time, in our efforts. There's often a significant dollar amount invested from NIH or NSF or other funding agencies to develop and test our interventions. But we also need assistance with investments to take interventions to scale. And it turns out that oftentimes those interventions are never used. They will sit on a shelf and go unrecognized. Having the right question early on is often critical to this process. And as we'll learn in a few minutes from Jeff, that is one of the key components of moving this process forward. So why is research put on the shelf? It's often irrelevant to the stakeholders of interest. It often, once designed, is too costly for either communities or practices to take up. It may be too difficult or complex to implement. And those things, if they're not thought about early on in the research process, will mean that the findings will never be used. So, you know, starting in the last 20 years, we began to understand these problems, but we often learn this at the end of a project. And the real question becomes, why do we learn this at the end of the project? We shouldn't have to continually learn this either with new researchers coming on. So anybody doing research can put the process that you're going to hear about in a minute into play. And I want to just emphasize before we move on, because there's often confusion again about community engagement. This is stakeholders. Your stakeholders could be patients and families. They might be caregivers. They could be communities or cultural groups. They may be clinicians, other researchers. They might be healthcare systems. They actually may be payers. They also may be legislators, policymakers, and industry. So there is a wide group of stakeholders that needs to be included in the research process in order to solve this problem of from time of discovery to time of impact. So Jeff's now going to talk you through a pretty idea about a process in terms of how you engage. And in this process, we hope that it will actually improve the relevancy. So these are the sort of outcomes you can think of if you work through an engagement process. It will improve the ease of implementation. It will decrease the cost of interventions, as well as, I think, you will find that you will develop strong partnerships with individuals that will assist you long-term in your research career. Jeff, you want to now talk about the process?
Sure, thank you. I appreciate that. I am Jeff Griever. As Pam mentioned, I'm the Community Engagement Program Manager for the Ohio State University Center for Clinical and Translational Science, or we like to say CCTS. Briefly, the community engaged research continuum that Pam was sort of referencing, we see that there's a sort of a spectrum here, and the, you know, as far as how much community involvement there is in any particular project. So the less community involvement that we see, we're going to be seeing investigator-driven research where there's very little input or and puts us at risk for less relevancy and importance to the people that we're actually trying to help, our stakeholders. As we move along the, you know, that spectrum, we come to, you know, community research that's done in the community, but not necessarily with the community. We call, you know, we're going to call that here community-placed research. If we get the community or the stakeholders involved a little bit more, you see that we change our terms, or we're basing the research in the community that provides a little bit more input. Maybe we involve them in best ways to recruit and get their buy-in to participate in a project. But again, maybe they're not quite as involved. As we move towards complete community involvement, and we'll talk about what that looks like at the various stages of the research process, but the more involved they are, the more it becomes community-driven research. And that means that they've helped at all stages of the process and have had input into what is actually going to be studied, how it's going to be studied. So they're a part of the research team. So we'll take a look at what that looks like here in the research process. So if you will let us simplify the research process with these, to help talk about it with these stages, we think about, you know, the timeline here of a research project is, it's important to consider when should we engage the stakeholders, at what stage of the process. And so many research teams have looked at that as we begin at the dissemination. We will bring the information to them once we have it to share with them. And so that is a very important time to do it. But in order to maximize impact, we should consider that we should do it sooner, at a sooner stage. So, you know, stakeholders should always be informed about the results of your research, because really, who has more invested interest or more vested interest in your results than they do? However, I would think that should suggest we bring them in earlier. So if we think about the data analysis phase, so, you know, should we consider bringing the stakeholders in and get them involved at this stage? And so, you know, analyzing data and interpreting data can be challenging enough to do, and I can imagine that it may make researchers a bit hesitant to consider involving stakeholders at this stage. However, it's important to consider that sometimes stakeholders may have some insight on why data may suggest certain patterns that researchers may overlook, or suggest certain conclusions that may be made from the information that we have collected as researchers. And so what may seem like an obvious or logical conclusion could be more complicated than it appears, and stakeholders may be able to identify some things that may not be easy for researchers to see at first. So, you know, think about what do your stakeholders think about your analysis, and be a good thing to sort of see what their input is, and do they have any input that may shape your conclusions or direct future projects, which is another thing to consider. So if we look at sort of the middle of the project, this is where the the work is the boots on the ground and where the rubber meets the road, kind of, if you will. This is the recruitment. This is, initiating the project, the recruitment, implementing the project, and the project maintenance stage. Stakeholders can serve in an advisory role and or as part of the actual research team, and helping with recruitment, being trained to help implement and maintain the project. And this also helps with sustainability after the project is concluded. If you think about, once the funding stops and the project, we've come to our conclusions and published, and we need to move on to a different project, possibly another community, we want it to continue and stay and continue to help the stakeholders in their environment, in their community. And so if we've had them be a part of the project, they feel ownership, they actually know how to potentially implement the project and know how to keep it going once the research team leaves and moves on. And so that's a really good foundation for sustainability in a research project. So if we look at the grant writing and the review, the IRB review process, we can get stakeholder input or feedback on a grant submission, especially if there are community representatives on the review committee. So we might incorporate stakeholders in writing the grant or in suggesting certain things there. But within the IRB, if we have stakeholders on that board, they might see something that we've overlooked that maybe is that needs to be adjusted in order for the project to be implemented in a way that is safe and or that is done well, and that will be that will have efficacy in a way that makes it impactful. And so we don't want to overlook that kind of input and insight that we might gain from a stakeholder. And if we go all the way back to the beginning, the study design, even coming up with the research question, this is important. Is this data really that we're thinking about collecting, is it really going to represent what's important to our stakeholders? We need to know what's important to them, and will they adopt our solution even if we're successful? So if we're coming up with a solution that would work, but that our stakeholders would never agree to go along with or to adopt, then really we're not really learning much and figuring out how to solve the priority issues in a stakeholder group. And how could it be more on point with their needs as we talk about priorities? If we look at a community that has a high rate of diabetes, we want to make sure that that is actually in line with their health concerns and the highest priority. Otherwise, they may be more focused on solving other issues, and it may be more difficult to complete a research project, or for our results and our project to have an impact on that community if their focus isn't on what we thought it would be, based on maybe looking at some data and identifying for them what's most important to them. So anyway, we just wanted to show you throughout the research process how you can engage stakeholders at every stage. And really, the answer is we should be doing it throughout the entire project at every stage. We encourage you to think about that and consider it when you are conducting your research. And that's something that we do at CCTS, that we help support researchers who are looking to do just that and figure out how to do it and help move things forward. So what I'd like to do now is introduce a couple of our guest speakers, if you will. Beverly, we had mentioned already, is a community engagement program manager. She lives in Southeast Ohio and works there as sort of an on-site person in the rural communities of Southeast Ohio. And she has been working with us for a while and has connected many research teams with community stakeholders and partner organizations over her 8 years with the CCTS. And Dr. Laureen Smith is a professor in the OSU College of Nursing. She has over 20 years of experience of doing community engaged work in both urban and rural populations. She told me the other day that she started in Detroit and she was doing work there in urban populations, and then has moved to do a lot of work in the Ohio and Appalachian region with her work. So I'll turn it over to them so that we can sort of get a hands-on, what does some of this look like in the real world, and how has it been put to use?
Okay, thanks, Jeff. For those who don't know me, I'm Laureen Smith, and I'm from the College of Nursing, and Beverly and I have actually just recently wrapped up a project where we worked together for 5 years or so. So I'm going to speak a little bit about some of our experiences, or my experience in doing primarily school-based intervention work. So you have to understand that that's the frame that I'm coming from, but I think that the things that I'll stress can be applicable across any community. So, and what I want you to understand is when you start engaging stakeholders, it's almost like you'll experience a snowball effect. So you will engage some group of stakeholders and they will suggest other stakeholders. And so, and if you take the time to do that, and it does take time, you will have a better and more rich understanding of where you are conducting your research and what their needs are. And so as I thought about what were some of the pros of engaging stakeholders, my list is very long. I've actually used stakeholders to help define a health problem. As Jeff mentioned, if you are trying to propose their participation or into a project and they're not interested in it, then they are not going to buy in, and the project will have a higher rate of failure, as opposed to a problem that they are truly interested in, that they truly want to address. They're also a source of data. So you might be focusing on national, state level data, but there might be local data that you're completely unaware of that they will tell you to go look at, or they'll help you access that data. They're a source of great qualitative data. So think about conducting interviews and focus groups and how you can actually turn that into a very, very good paper. Probably in my work, the biggest help that stakeholders have been to me has been in developing and carrying out recruitment and retention plans. I just completed a 20-school project. And so as you can imagine, every school has individual needs. And so we relied on the stakeholders to help us design tailored recruitment and retention plans and tailored protocols for each school. So the stakeholders helped us to really kind of refine our approach to each school, which helped us be successful in completing it at all 20 schools. Now, when I talk about stakeholders, you initially think of the people that will agree to allow you to conduct a study in a community setting. But what we learned, one of the most valuable lessons that I learned, and for my case, that's often the principal or a superintendent, but the people that you really need to talk to are the people that I call the boots on the ground, the people whose work you're going to directly affect or impact. So in our case, it was the teachers, the school nurses, and the counselors, and in one place, the librarian, because we were guests in those schools, and we had to work out procedures as to where we would conduct our intervention, what was the physical location, what time, what classes would it impact, how does this affect their school lunch or their other academic needs. And so you really need to go beyond the people who may have written your letters of support and talk to the people who actually it will be directly related to. I think that's a really important lesson. Now, I told you that we tailored our intervention to each school. And so we got that through suggestions. And so one of the kind of cons or concerns or things that you need to think about as you do that is how do their suggestions impact the fidelity or the integrity of your project? You always have to keep that in mind, because they might have great suggestions, but it might get to the point where it's not going to be scientifically sound to do it. And so what I have found when I kind of determine that is I'm just telling them the truth, that this is a funded project, and we only have so much flexibility, and that might go beyond the things that I'm comfortable with. Also, some of their suggestions that sound great on paper do not work out in reality. And I'll give you an example of that. One of our schools insisted that we do our intervention time. And it was about a 40-minute intervention during lunchtime. That was not good. We tried it. It did not work well. The kids were too distracted. They wanted to spend their lunchtime with their friends who they've not seen all day. And so, you know, sometimes you have to decide that was the suggestion, we'll try. And we had to try to change it because it just wasn't working. So that was one of the key lessons that I learned. And the other thing that I would tell you as you do this kind of work is try to employ or use on your team local residents, because they know things that you don't know. As I mentioned, Beverly and I just wrapped up a project together that, you know, I was the PI on. But really, if you talk to the people in Southern Ohio, Beverly was the face of the project. She's the person that they interacted with the most. It was great because Beverly was from that area. She also made recommendations for me to hire people. So I'll hand that over to Beverly now, but I just want you to know how critical having local people involved in your projects will be for you to do this kind of work. Okay, Beverly.
Thank you, Laureen. I am Beverly Stringer, and I'm the Community Engagement Program Manager for Southeast Ohio. I've actually was born here, raised here, raising my family here, so I literally am a part of Southeast Ohio, inside and out. And the stakeholders in our communities here have an important role in research and community engaged research. Being a part of the Southeast Ohio community helps me to understand what our needs are and who to contact when we have specific topics or issues to address. I'm active on various coalitions, community groups, and boards, and we have multiple community partners here in Southeast Ohio, and they're very diverse. That goes from schools, churches, community organizations, and community members. Over the years, I have been active with the CCTS, community engagement. I've built many relationships. And this is helpful for both not only the researchers, but also the community partners. I am the face or gatekeeper to introduce people to each other. I feel like I'm a professional liaison. We have a community engagement advisory board that meets quarterly, and it has 20 members from throughout the Southeast Ohio region. This is an avenue for researchers to obtain feedback on projects or to even share their findings with community members. This also provides a way for the community members themselves to seek assistance from the research community. An example of our community advisory board reaching out started with a casual conversation during one of our meetings, and it was in regards to the high numbers of Hep C that we have here in Southern Ohio. The group wanted to do something but wasn't sure what that would look like, and they felt that we needed to educate ourselves a little bit more. So I reached out to researchers at Ohio State University and also researchers at Nationwide Children's Hospital. And we invited several different teams to come down and talk about their projects and what they and shared their knowledge with it. And this initially led to a small group getting together, doing community interviews, focus groups, and then this information was put together for another application for a larger grant application and led to a bigger project. I have assisted researchers to obtain letters of support and also recruit from the local community members to be part of research teams. I have shared the needs and concerns with the researchers of our community partners, and I've helped to facilitate researchers and communities to form teams to help address our health disparities. It's when we work together as teams that we become part of the solution that we're all seeking.
So great application of the continuum of how you engage stakeholders. I have one quick question, and I'm going to put Laureen on the spot. I heard at various places where you gave examples that stakeholders helped you maybe change your procedures or change the way you did things. I'd be interested if that also happened on the research question itself. Were they insightful at any point in what and how you might have changed a question, and maybe subtly or more dramatically after you worked with the community?
Yes, I was talking about this yesterday, that I had an expansion project in the state of Tennessee. And so we were kind of going through the questionnaire. It was about sugared sweetened beverages. And so we were going to ask, we had a reliable and valid tool that we were going to use, that I used here in Ohio, and we were going to apply it to Tennessee. Well, I showed it to the school teachers and some of the people I was working with in Tennessee, and they suggested that we alter the form a bit. For example, we might call Coke or Mountain Dew Pop here in Ohio, and they call all forms of soda Coke. And so they said we really need to call it just Coke, because that's what the kids will know it as. And so if I had not done that, if I had not listened to them, I may not have gotten the responses. It might have been underreported because the kids didn't know what I was referring to. So that's just a more recent example of how they've helped me do that. In a project that I completed a few years ago, it was a true CBPR approach, and we actually relied on local health coalitions and local stakeholders to help us define what the health problem was that we were going to address, the population that we would target, and how we would do it. And so they were critical to the success of that project.
Great. So I'm just going to have a few wrap-up points, and the examples that Laureen and Beverly gave you were the community engagement, where you see the research being done with a particular community. But what you can take away from this discussion is how much interaction with stakeholders happened, and how that transformed the work. And the ideas about asking your population, whatever that population might be, about what's important to them is key at the beginning. I think the advice that came out of this in terms of making sure you engage your population around your instruments, around recruitment, can be invaluable to making sure that your research project is successful, and raising questions about how you retain individuals in the research. So again, lots of lessons that can be applied across, no matter what kind of research you're doing, as long as it's with sort of human subjects. The lessons that both Laureen and Beverly discussed are lessons that we can all learn from. I would just give you this final information, and that is that the CCTS, as we both, Jeff and I mentioned, and Bev, are associated with the Community Engagement Program Core. If you want more information about how that core might be able to support your work, we have given you Jeff's contact information here. Feel free to give him, probably at this point, emails are best. And we can assist you in making sure that your research engages whatever the population that you're working with in a robust fashion, to not only make your research more impactful, but I think will make it more enjoyable and successful in the long run. So again, thanks for joining us and tuning in to this short presentation. Again, meant to be a introduction, but please feel free to contact us for additional help. Thank you.